Just as it is with ourselves and our human family members, addressing dental disease should be a very important part of preventative care for our pets. Dental disease is a chronic, progressive issue that develops early and continues throughout life. If it is not dealt with in a timely manner, dental disease leads to bad breath, bacterial infections, unnecessary tooth loss, chronic pain, and a shortened lifespan.
The one difference with professional dental cleanings being performed on dogs and cats is that they require general anesthesia in order to do this safely and effectively. The idea of anesthesia is scary to most people, especially when it comes to their pet. At Hampton Veterinary Hospital, we understand the risks of anesthesia and take them very seriously. We go above and beyond to minimize these risks with the goal that each pet do well under general anesthesia, recover comfortably afterwards under our care, and go home a healthier pet.
Prior to the date of your pet's dental procedure, we perform pre-anesthetic lab testing to ensure that your pet is healthy enough to have general anesthesia. This blood testing helps our doctors to determine how safe it is for your pet to be anesthetized and what specific anesthetic medications will be best for your pet. Starting the night before your pet's dental procedure, you will need to make sure they do not have any access to food after bedtime or the next morning. Please leave water down so that they remain well hydrated. You will then bring your pet to our hospital at your scheduled time between 7:30 and 8 a.m. A veterinary technician will go over all necessary paperwork, answer any additional questions you may have, and then admit your pet to the hospital for the day.
The doctor will perform a thorough physical examination to confirm the health of your pet prior to anesthesia. The doctor and staff will then create an anesthetic plan for your pet's age and health status. General anesthesia depresses most every major body function, so we take great care to ensure that we are monitoring each patient's vital signs and provide appropriate care to maintain their health during and after anesthesia. Every patient has an intravenous catheter placed in order to provide intravenous fluid therapy to maintain their blood pressure and keep their kidneys perfused, administer anesthetics and pain medications, as well as to provide rapid access to administer life-saving medications should the need arise.
Pre-anesthetic medications are then administered to each patient to provide preemptive pain management and sedation. These also allow for a smoother recovery while waking up from anesthesia. Once they are fully anesthetized, we place an endotracheal tube into their windpipe in order to administer gas anesthesia. This tube also protects the lungs from pieces of tartar, water, and bacteria, preventing pneumonia from occurring. It also keeps a patient's airway open for maximum oxygenation during anesthesia. We utilize multiple warming systems to ensure that each patient maintains their body temperature while under anesthesia.
At Hampton Veterinary Hospital, we feel strongly that the most critical factor to ensure a safe and healthy anesthetic outcome is by devoting a highly trained veterinary technician to monitor your pet's anesthesia and recovery. They monitor and keep track of all of your pet's vital signs during the anesthetic procedure, including heart rate and rhythm, respiratory rate, blood pressure, blood oxygen saturation, end-tidal carbon dioxide, body temperature, depth of anesthesia, and symptoms of pain. With having an anesthesia technician devoted to continuously monitoring each patient, a comprehensive understanding of anesthetics, and the ability to adjust IV fluids, anesthetic levels, and pain control, we can be confident in our ability to provide a safe anesthetic procedure for your pet.
Once your pet is safely and comfortably under anesthesia, we then begin their dental procedure. A second highly trained veterinary technician will perform your pet's dental cleaning. This involves ultrasonic scaling of all the tartar from their teeth and gum pockets, charting your pet's dental health, and taking full-mouth digital dental radiographs on all patients to assess their tooth roots and surrounding bone for any underlying abnormalities, such as tooth root abscessation, bone loss, loose teeth, and resorptive lesions. Your veterinarian will also evaluate your pet's teeth and radiographs to determine whether any additional treatment and/or tooth extractions are necessary.
Our goal at Hampton Veterinary Hospital is to recommend regular dental care for your pet so that we can minimize periodontal disease and the need to extract problematic teeth. However, when extraction is required, we provide your pet a combination of both short and long-acting medications to control their pain both during and after their dental procedure. This includes local anesthetic blocks, injectable morphine-like medications, non-steroidal anti-inflammatory medications, and non-invasive therapy laser treatments. Many times, tooth extraction can be complicated, so our doctors have been specially trained to perform surgical extractions, very similar to what we as humans would have done by an oral surgeon. We do so in order to be less invasive, cause less pain following the procedure, provide faster healing, and to close the root pockets in order to keep food and debris from accumulating by using dissolvable sutures to close the areas.
At the end of your pet's dental procedure, the dental technician polishes their teeth to make them a smoother surface to help slow down plaque and tartar development. Your pet is then woken up from general anesthesia within minutes after the procedure is completed. They will be monitored continuously by the anesthesia technician until they are fully awake. Your pet will be placed in a warm, comfortable cage in our treatment area so that they can be monitored regularly until they are ready to leave the hospital. Once your pet is awake, the doctor will telephone you to let you know how they did under anesthesia and how their procedure went. They will also schedule you a discharge appointment so that a technician can go over all home care instructions and answer any questions you may have.
If any tooth extractions or surgeries were performed, we will ensure that your pet receives appropriate pain management in order to remain comfortable while he or she is recovering at home. The following day, we will call to see how your pet is doing, and we'll schedule a complimentary progress exam in a couple of weeks to evaluate how their mouth is healed by that time. We will also go over regular home dental care at this visit to give you the tools to help slow down the progression of dental disease in the future.
Providing optimal dental care for our patients allows them to live longer, healthier lives. If you have any further questions, please feel free to speak to any of our doctors or staff members here at Hampton Veterinary Hospital.